Welcome back to the channel, everyone. Have you ever found yourself needing to pee again immediately after going to the bathroom? Or maybe you're finding that you're not able to fully empty your bladder when urinating. This is called incomplete bladder emptying, and in this video, I'm going to teach you exactly how to fix it. And if you're new here, my name is Eric. I'm a men's health physiotherapist, and this channel is dedicated to men's health physiotherapy and helping you to overcome men's health issues. I post new videos every single week, so make sure you subscribe to the channel by clicking the subscribe button below and join our growing community. Incomplete bladder emptying is very annoying, and I think we've all experienced this to some extent, as this can happen to men of all ages. And I've had clients that are young as 15 and as old as 75 experiencing this issue. Incomplete bladder emptying can bring on other issues such as hesitancy when starting your urine flow, urine dribble after peeing, or you might find that you're only urinating small volumes when you know that you have more urine left in your bladder to empty. And this can cause frequent trips to the bathroom and generally a lot of frustration. Thankfully, there's a lot that can be done to fix this issue, and that's what we're going to dive into today's video. Make sure to stick around all the way to the end of the video so that you can learn all the tips and get on the right track to resolve your incomplete bladder emptying. Now, it's important to highlight that if you're experiencing frequent problems with the general emptying of your bladder or initiating that flow of urine, this can be a real medical emergency where doctors must manually empty your bladder for you. So please go to your GP and get this checked out if you are unable to urinate. I always recommend that men go through a quick checkup with their doctor first because there are a few things that might be causing some of your incomplete bladder emptying issues. For those men over 50, you might be experiencing what's called an enlarged prostate, whereas some men might be experiencing issues with the pee tube itself obstructing the flow of urine. And lastly, some might be experiencing issues surrounding their pelvic floor muscles, impeding their ability to fully empty their bladder. So with that said, make an appointment to visit your doctor, and now sit back, relax, and enjoy this video. Let's start this video off with a bang. We need to talk about your bathroom position and urinating technique. Yes, I know this might sound funny, but correcting your position and perfecting your technique is important when trying to fully empty your bladder and to fix this issue. Now, in my opinion, if you're struggling to completely empty your bladder, the best position you can try is sitting down when urinating. And I know, guys are supposed to stand in front of a urinal to pee, right? Well, this isn't always the case. Sure, you can return to standing in front of a urinal once you learn to completely empty your bladder, but for now, sitting is the best way to go. When you sit down to urinate, you're able to relax your abdominal muscles, also known as your core muscles, which also helps to relax your pelvic floor. Sitting on the toilet, make sure your feet are flat on the floor, pop your chest up, sit up straight, and then lean forward with your hands resting on your knees. This is the posture you're going to maintain the whole time. Now, the key here is to close your eyes and then relax your stomach completely. Next, take a few deep breaths in and out into this position so that you relax and then start urinating. You want to make sure to be patient and allow your bladder to completely empty while sitting with your eyes closed and breathing deeply. Now, once you finish, if you find that you still have urine to empty from your bladder, my best tip is to slowly stand up from the toilet and stand for around 2 to 3 seconds and then sit back down on the toilet. And this is called double voiding. If you're in your bathroom at home, you can stand up and walk around the bathroom and then sit back down. However, if you're out in public, I suggest just standing up in the stall and then sitting back down. And I want you to remember, the key thing here is that you need to be patient with yourself. If you rush this process, you're naturally going to clench your abdominals and your pelvic floor muscles, making this worse. When we're focusing on correcting your position and technique of urinating, this will help you decrease the number of times you'll have to use the bathroom afterwards. So just take a deep breath, be patient with yourself. All right, let's quickly recap. We just went through the proper positioning and the proper technique when urinating. Now we're gonna dive into pelvic floor relaxation. For those that don't know, your pelvic floor is a group of muscles that acts like a hammock spanning from your pubic bone up front all the way to your tailbone around back. And this group of muscles is responsible for helping you with urination. Therefore, if you're experiencing incomplete bladder emptying, it could be that your pelvic muscles are really tight and overactive, impeding your urine flow and the ability to completely empty your bladder. And this is where a pelvic floor relaxation routine can help you to relax these muscles. However, this is a tip that you'll need to practice at home in order to start seeing results when going to the bathroom. First, to start off with, you want to find a quiet room at home with minimal distractions. Next, we're going to start you in the lying position on the floor. Place one pillow underneath your head and the other pillow underneath your thighs. Now that you're in position with your thighs elevated on pillows, close your eyes, and I want you to mentally perform a scan of your body for any areas that you might feel a little tighter than others. Mentally, make your way scanning to your pelvis area and notice any tension in this area. Next, bring your hands up and place them over your stomach and feel your belly expand and retract as you continue to take deep breaths in and out. You want to focus your attention to the tension in your pelvic floor region, deep underneath your pelvis, just below where your hands are placed over your stomach. Okay, start by taking a deep breath in, and when you release this breath and breathe out, try to relax around the base of your penis and your anus, and allow your testicles to relax away from your body. Picturing your pelvic floor like a hammock, running front to back, try your best to just relax this area. Breathe deeply into this area and stay focused on relaxing these muscles for around 8 to 12 deep breaths. Now, this is what you call a pelvic floor relaxation session. You see, we spend most of our days sitting and possibly in stressful situations. All this sitting and tensing is naturally going to tense up your pelvic floor muscles, making your problem with incomplete bladder emptying much worse. I recommend that you try to perform a pelvic floor relaxation session much like the one we just went through, around once per day for the first couple of weeks, and then as your symptoms improve, you can decrease this and perform it every other day. I want you to try it out for yourself. I think it's really going to help you. Lastly, we need to discuss the different medications you can try to help to completely empty your bladder. If you're trying the tips mentioned above and you're finding that you're still struggling to completely empty your bladder, well, it's time to go back to your doctor and ask for a prescription. Your doctor might find that you have an enlarged prostate contributing to your incomplete bladder emptying, and they can prescribe you medications to help relieve your symptoms. However, every medication you take and put into your body is gonna come with some type of side effect, and that's why I always recommend you try the lifestyle advice in this video first, such as the position and technique we went through just before, and also the pelvic floor relaxation techniques. And that's gonna wrap up today's video. I hope you enjoyed it, and I hope that it helps you completely empty your bladder. Remember, it doesn't matter if you're 15 years old or 65. These tips will help you, so make sure you give them a try for yourself, and remember to be patient. This issue isn't gonna fix itself overnight. And if you haven't done so already, please consider liking this video and subscribing to my YouTube channel by clicking the button below so that you can join our growing community. And remember, regardless of your situation, keep going, and I'll see you in the next video.